Your contribution. We move on now to Deputy Stephen Donnelly. Deputy Donnelly, you have 10 minutes.
Thanks, Ceann Comhairle. Ceann Comhairle, I'd like to thank all parties and independent TDs who've signed up to the motion before us. There's a lot of concern about the fact that we have a minority government, and those concerns may in time prove well-founded. I hope they don't, but they may. However, the minority situation also provides this Dáil with a voice that it hasn't had before. It provides this Dáil with the opportunity to table motions and legislation. It provides this Dáil with the opportunity to build cross-party coalition for good ideas. Now, the Social Democrats may have initiated the motion before the House today, but this is a motion of the Dáil, supported by all parties and groups. And it is this cross-party approach, Ceann Comhairle, that hopefully, through this cross-party approach, hopefully we can achieve some important breakthroughs in healthcare. The motion calls for the establishment of a committee to look at 4 specific healthcare challenges. First, the existing and forecast demand for healthcare services. Second, how to progress a model of healthcare that advocates the principles of prevention and early intervention, self-management and primary care services, and integrated care. Third, and I imagine the committee will spend a lot of time on this, the different funding models available for healthcare. And then fourth, how best to reorient the health service from an acute-based system towards an integrated primary and community care system. I think, Ceann Comhairle, it's also important to note one line in the motion that is very important, and the quote is this: the need to establish a universal single-tier service where patients are treated on the basis of need rather than on ability to pay. Now, that's a very serious statement for this Dáil to make. It is a cross-party statement. It is a statement signed up to by, I believe, all of the independent TDs, Ceann Comhairle, and apologies if I'm mistaken on that. But today the Dáil is stating that we need a single-tier healthcare system with universal access that is not based on the ability to pay, that is based on need. Now, that is a major departure from the healthcare system which we have in Ireland today, and I very much welcome that statement getting such agreement in the House. And there's more that most, if not all, members of this House agree on, that our healthcare system should provide a high-quality, modern and timely service, that service should be provided as close to the patient as is practicable. That our healthcare system should be cost-effective and should invest in prevention and early detection. That our healthcare system should protect people's dignity, something that I know our clinicians try and do on a daily basis, but something that sadly they are not always able to provide for a variety of reasons. That our healthcare system should be a rewarding and exciting place for our clinicians and non-clinicians to work in. And that our healthcare system should be open to change, responsive to concerns and accountable for its work. Something I would argue, and many members of this House I believe would argue, that is not currently the case. And Ceann Comhairle, it is important to recognise some of the successes we've had in healthcare. The success in paediatric leukemia treatment, for example, is something that needs to be acknowledged as a great success, and progress has been made in recent years in Ireland. But the system as a whole is struggling. We all know that. International comparisons don't suggest that Ireland does very well. The European Health Consumer Index, for example, ranks us as 21st out of 35. So we're in the bottom third, more or less, or close to the bottom of the mid-group. And the index also found that we have the longest waiting times for emergency care in Europe, something we need to take very seriously. Today, there's nearly 300 people on trolleys. In my own constituency of Wicklow, in the area that's West Wicklow and Kildare, there's over 1,800 people waiting for speech and language assessment, and the vast majority of them are children. Over 1,800 waiting, and the waiting lists are 18 months to 2 years. We all know that by the time some kids get that care, actually a lot of the help that could have been provided has been missed. We heard, Ceann Comhairle, over the weekend that the bone density scanners in Galway University Hospital have now been shut down. We have 2 high-tech machines that were running 5 days a week, and now both of them have been mothballed due to lack of staff. Now that's something that we can't allow. I'd also like to draw attention to what's going on in the Kappa Hospital. This is our National Orthopaedic Hospital. Kappa has 7 operating theatres. And those 7 operating theatres used to operate every day. And my understanding is that a surgeon in a given 8-hour list could do about 7 procedures. 2 of the 7 operating theatres have been closed down indefinitely. Another 2 have been closed down for refurbishment, but with no understanding as to when they're going to open up again. So the National Orthopaedic Hospital has 7 operating theatres, and of the 7, only 3 of them are being used. But actually it's worse than that. Because what happens is a given orthopaedic surgeon takes one of those 3 operating theatres for a given day, Monday, Tuesday, Wednesday, whatever it is. And what those surgeons are now being told is, not only can you not have it every Monday, you can have it every 2nd Monday or every 3rd Monday, because we've gone from 7 to 3, but actually when you have it, you're not to do as many procedures as you could. Maybe you could do 7. What you're to do is 4 and then go home. We'll still pay you. We'll still pay the 22 million that it costs to run Kappa Hospital. We'll still pay for the theatre teams. We'll pay all of the costs. And the reason you've got to go home is because the only thing we're not going to do is pay for the implant. So we've got a hospital, we've got a car park, we've got insurance, we've got surgeons, we've got technicians, we have operating theatres, we have wards. We're going to pay for the lot. We're just not going to pay for the implants. And therefore, rather than having 7 operating theatres, doing 5, 6 or 7 procedures a day, we have 3 operating theatres doing maybe 4 procedures a day at more or less the same cost. We pay the 22 million for the hospital, and we pay some of the 1.5 million for the implants, but not all of it. Now, that's the kind of thing that's going on in our hospital system today. So what happens is those who can afford private care, they go and they get it. So the waiting list at the moment for a surgeon I was talking to is 18 months, but his private list is 6 months. So we have a 2-tier system. We have healthcare for those who can afford it, and we don't have healthcare for those who can't. But of course, what's really frustrating is the issue isn't lack of funding. It's not that there's not enough money going into the HSE. We have the 2nd highest expenditure ratio on healthcare in the OECD. The 2nd highest in the OECD. We spend the money, we're just not getting the service for that money. And of course, the issue is not our clinicians. We have some of the best trained clinicians on earth. So we have some of the best doctors and nurses and surgeons. We pay the 2nd most on earth. And we're taking our national orthopaedic hospital and saying, close down over half the operating theatres, don't do as much with them as you can, leave people with deteriorating conditions ending up in wheelchairs because we don't have the money for the implants. I mean, that's what's now happening on a daily basis in this country. Now, there's lots of reasons for the low performance in our system. There's a lack of local autonomy for hospitals. There's poor accountability and transparency in the HSE. There's little econometric analysis to show where we need healthcare. We don't have integrated ICT systems for patient records. We have very siloed rather than continuous and holistic care pathways in a lot of places. We have a deep culture of mistrust between clinicians and managerial staff across our healthcare system. It's corrosive. And it isn't there in other countries that I've worked in. There's little access for patients to clinical data, quality data, so they don't know which hospitals are good and which hospitals are bad. Some are good, some are not so good. We're not allowed to know. There's poor working conditions for clinicians, and the list goes on. But behind it all, Cian Corla, behind all of these operational reasons, because each of those operational challenges is solvable, but they're not being solved. So why not? Behind it all is a lack of vision. We can't achieve success in healthcare in Ireland because we haven't agreed what success is. We can't give our managers and our clinicians the tools they need to succeed because we haven't told them what we want them to do to succeed. We need a unified strategy for healthcare, but for that, we need to know what the strategy is trying to achieve. And right now, we don't know that. And that's why this motion is so important. Because it brings together a cross-party group where we can all bring in political ideas, but hopefully it is not used as a political football. We can bring this cross-party group together to ask some questions like, what are the different types of healthcare systems, services we need, and where are they needed? How do we support prevention and early detection? How do we move to an integrated primary care system? How much money are we willing to spend on healthcare? Because you can spend as much as you want on healthcare. And how are we going to raise that money? If we can make progress on these questions, then we can put a long-term system in place with agreement on what it is we're trying to achieve, how we're trying to achieve it, and critically, how we're going to pay for it. We need to be honest about some uncomfortable political truths as well, and the committee is going to have to look at these, like the fact that modern healthcare requires an increasing amount of money because it's becoming more sophisticated and people are living longer. Like the fact that modern healthcare requires a level of scale, making it impossible for all services to be delivered everywhere around the country. We're going to have a serious conversation about this. And like the fact that some hospitals are simply better than other hospitals. And people have a right to know who's doing well and who's doing badly. I'll finish, Count Corla, by saying this. We need a vision for healthcare. We need cross-party support. We also must learn to start trusting our clinicians and our managers in the primary care centres, in the hospitals, in the hospital groups. So whoever is on this committee, I wish them well. I think they're going to be faced with some very difficult technical issues. I think they're going to be faced with some very difficult political issues. But if this committee can succeed in bringing back to this House a vision for healthcare and real options on how much it's going to cost and how we can fund it, we can start moving on and accepting that if we are going to spend more than almost anybody else on healthcare, then by God, let's get the best healthcare system in the world for that money. Thank you.
Deputy Donnelly.